Hi, my name is Sarah Ducharme, and this is my final presentation for Developmental Psychology with Professor Susan Poulin at MCHP. Ego integrity versus despair, life for aging Americans. What does each and every person in the world have in common? Regardless of race, ethnicity, sexual orientation, religious beliefs, socioeconomical status, unless an accident or an illness results in our untimely death, we all will grow old. Americans refer to their advanced age community as senior citizens, referring to people ages 65 and up. What does life look like for aging Americans? What struggles do they face? What joys? The experience of the aging American will be the experience of all of us. We should pay attention. Erik Erikson's eighth and final stage of psychosocial development is ego integrity versus despair. At this stage, one looks back on their life and reflects. Those who feel proud of their accomplishments will feel a sense of integrity. Successfully completing this phase means looking back with few regrets and a general feeling of satisfaction. These individuals will attain wisdom and a sense of peace, even when confronting death itself. If the individual has many regrets and does not attain a sense of peace, they will be left with a sense of bitterness and despair. What is the difference? Why do some individuals look back on their life with pride and joy, while others succumb to pain and regret? What are the impacts to society? There are many aspects to consider when looking at a life well lived. For aging Americans, the most influential impacts are finances, health, society, family, and legacy. According to the U.S. Census Bureau, there are about 46 million Americans aged 65 and up. Over half of them, about 25 million, are economically insecure, according to the NCOA. 43% of single seniors depend on Social Security for 90% or more of their total income. On average, older women receive $4,500 less annually than their male counterparts due to lower lifetime earnings. The NCOA also reports that more than 60% of Americans aged 65 and up still face some form of debt, an average of $40,000. Also weighing in is the rising cost of prescription drugs and the current costs and limitations of health insurance. It's clear to see that many of our seniors face very challenging circumstances. Consider Maslow's hierarchy of needs. Before one can reach self-actualization, or the very sense of well-being and peace referenced in Erik Erikson's ego integrity, physiological and safety needs must be met first. If an aging senior faces food insecurity or cannot afford medications, the likelihood of them attaining this stage diminishes. Let's delve a little bit deeper into healthcare. Almost all Americans 65 and up are eligible for Medicare, and that is important. There are, however, limitations to the helpfulness of the program. The National Council on Aging reports that 80% of seniors live with one chronic health condition, and 77% of seniors have at least two. Hypertension, diabetes, CHF, COPD, and falls are the most common conditions that affect senior citizens in the U.S. Medicare has a gap on prescription drug coverage. Once the plan pays out $3,750, coverage is reduced to 25%, meaning a 75% copay for our seniors, until they pay an additional $5,000 out of pocket, at which point coverage resumes. The gap is expected to improve through 2020. However, many seniors are in dire situations as drug prices double and triple each year. Hospitals and doctors' offices report patients stretching out their prescriptions to save money, for example, taking only a half pill every day instead of a whole one. Again, considering Maslow's hierarchy of needs, safety must be met before one can attain self-actualization or ego integrity. In the U.S., aging has a negative connotation that is not found in other countries. In China, elders are revered and honored for their wisdom. Here, that could not be further from the truth. We refer to Alzheimer's disease as old timers in jest. We spend billions of dollars on looking and feeling younger. David Bernard from Money Magazine writes, "Some terms typically used to describe older folks can be far from flattering, including wrinkled, grumpy, crotchety, absent-minded, forgetful, fragile, feeble, stuck in the past, past their prime, or a burden on society, just to name a few. That is not exactly how you might wish to be perceived by the world, and yet, if you ask those living the role of older people, you may discover those negative terms do not accurately represent reality. And that's true. According to the U.S. Census Bureau, senior citizens will outnumber children in the U.S. by 2035. According to longtermcare.gov, someone turning 65 plus has a 70% chance of requiring long-term care within the next 15 years. These statistics lead to a stereotypical view on aging: a weak, frail, fragile, white-haired individual with confusion and a cane. This literally couldn't be further from the truth. 95% of senior citizens currently live in their communities, not in a nursing home. 80% of men 70 plus still drive. Times are changing. According to Bernard, in 2001, 62% of seniors reported that retirement was a time to wind down. In 2011, just 10 years later, 55% of seniors reported that retirement was a time to explore, adventure, or travel. The last and perhaps most important piece to consider is legacy. In an interview that I conducted, including 50 seniors who were inpatient in a care facility, 90% that had close relationships with their children and grandchildren reported feeling happy and content with their lives and their legacy. It is not necessary to have children to feel satisfied with one's lives. People reported contentment with their careers, relationships, spouses, siblings, nieces, and nephews. What the content people had in common was relationships with others,